In a high-stakes turn of events, Labour's new pension tax policy proposals are under fire, with the British Medical Association, BMA, sounding the alarm over potential irreparable damage to the National Health Service. The controversy centres around Chancellor Rachel Reeves's rumoured tax reforms, including possible cuts to pension tax relief and the reintroduction of a lifetime allowance on pensions. As the NHS braces for an already challenging winter season, doctors across the UK are voicing urgent concerns, warning that Labour's moves could push healthcare professionals to retire early or reduce their working hours, leaving a devastating void in the nation's medical workforce. Ahead of Reeves's upcoming autumn budget announcement, the BMA has taken a firm stance, calling on Labour to reconsider any drastic pension changes. Their primary message? Targeting pension relief could risk an exodus of experienced doctors and derail NHS services that are already stretched thin. With the nation's health system still struggling with record-breaking waiting lists, this potential tax shift has raised questions about whether Labour is setting the NHS up for failure. As the BMA pushes back against Labour's tax agenda, they've sent a direct warning to Reeves about the potential fallout from changes to doctors' pensions. The union, representing over 170,000 doctors, has urged Labour to remember that healthcare professionals are already under enormous pressure due to high patient demand and limited resources. Further strain on doctors' pensions may be the last straw, one spokesperson stated, underscoring the BMA's concern that these policies could dismantle an essential support system for NHS professionals. Dr. Vishal Sharma, chair of the BMA Pensions Committee, emphasised the potential dangers of Labour's tax proposals, saying, "The wrong changes to pension taxation could completely derail the government's plans for the NHS before they have even started." Dr. Sharma highlighted how existing policies, like the tapered annual allowance, already prevent doctors from working additional hours without incurring hefty tax penalties. Labour's new reforms, he cautions, would only exacerbate the issue, pushing even more senior doctors out of the workforce. This issue couldn't come at a more crucial time for the NHS. As part of Labour's healthcare plan, the government promised to reduce record waiting lists by creating 40,000 additional appointments per week. But doctors argue that these ambitious goals could become impossible to achieve if more of their colleagues decide to retire early or limit their shifts. The NHS, already facing a serious shortage of skilled professionals, now stands at the brink of a pension-fueled crisis. Adding fuel to the fire, AJ Bell CEO Michael Summersgill joined the BMA in calling for stability, urging Chancellor Reeves to adopt a pensions tax lock. His proposal would see the government commit to a freeze on any changes to pension tax relief until at least the end of the current Parliament, providing long-term reassurance to doctors and other key public sector workers. This isn't just about short-term costs, Summersgill stressed. The uncertainty around pensions is already affecting doctors' decisions. If Labour goes ahead with these changes, we'll see lasting damage. Summersgill also explained how the rumoured changes are affecting the entire pensions industry, noting that the ongoing debate has created widespread anxiety and influenced people's decisions around retirement and savings. When individuals are making long-term financial decisions based on budget fears, the outcome is never good. We need a firm commitment to stability, not sudden shifts that could hurt savers, retirees, and our public services, he continued. Many healthcare analysts agree that Labour's stance on pension reform may backfire, damaging the NHS at a time when it desperately needs strong, stable support. While Labour's focus on creating a fair tax system is one of their key selling points, critics argue that these changes could undermine the very public services they aim to protect. Meanwhile, Reeves's team insists that no official decisions will be revealed before the fiscal announcement, leaving NHS staff and healthcare advocates anxiously waiting. A Labour insider, however, hinted that the proposed reforms are a necessary measure to balance the budget and ensure everyone pays their fair share. But this approach, as BMA members argue, fails to account for the reality that healthcare workers are often hit hardest by such measures. As the backlash builds, Labour's own ranks are growing increasingly concerned. Several Labour MPs have expressed disquiet over the potential pension tax cuts, worrying that the policy could alienate healthcare professionals and risk a fresh wave of strikes. Given the BMA's previous willingness to strike over tax issues, there is widespread speculation that Labour's proposal could lead to a major showdown with doctors, which would not only impact patient care, but also cast a shadow over Labour's healthcare record. But pensions aren't Labour's only challenge. Prime Minister Starmer is simultaneously embroiled in another controversy, this one international. At a recent Commonwealth summit in Samoa, Starmer faced unexpected resistance over his reluctance to address reparations for the transatlantic slave trade. Caribbean leaders, along with prominent backbench Labour MPs, have pressed Starmer to acknowledge Britain's historical role in the slave trade and engage in discussions on reparatory justice. But the Prime Minister has so far refused to budge, insisting that Britain must face forward and focus on the future rather than past grievances. Starmer's stance on reparations has already drawn criticism from leaders within the Commonwealth, such as the Bahamas Foreign Affairs Minister, Fred Mitchell, who stated, "It's only a matter of time before his position changes." Mitchell's comments reflect a growing sentiment among Commonwealth members, who are pushing for the UK to take greater responsibility for its colonial legacy. Despite Starmer's resistance, a leaked draft document from the summit revealed that some Commonwealth countries are pushing for a statement on reparative justice. Such a declaration would stand in stark contrast to Starmer's stance, placing additional pressure on him to reconsider. This tension has exposed a rift within Labour, as backbench MPs like John McDonnell openly criticise the Prime Minister's approach. Failing to address the past isn't just short-sighted, it's a failure of leadership, McDonnell argued. If we're serious about equality, we need to acknowledge our history, not sweep it under the rug. The Commonwealth debate is quickly becoming a litmus test for Starmer's leadership. As he navigates the backlash over pension reforms and reparations, Labour's credibility is being tested on multiple fronts. Doctors, backbench MPs and international leaders are all demanding that Starmer and Reeves take a more proactive, transparent approach. With each passing day, the question looms larger. Can Labour keep its promises on healthcare while upholding Britain's international relationships? Labour's response, or lack thereof, will likely have lasting consequences on its political fortunes. As Farage's Reform UK capitalises on Labour's perceived missteps, positioning itself as a voice of common-sense policies, Starmer's administration risks alienating not only doctors, but also key voter bases that helped bring them to power. Reform UK leader Nigel Farage has already seized on Labour's struggles, claiming that the current government is out of touch with the needs of working-class Britons. It's a high-stakes moment for Labour. As the countdown to the autumn budget continues, doctors are left waiting to see if their concerns will be addressed or ignored. And as the Prime Minister manoeuvres through international diplomacy, he must weigh the benefits of a forward-looking narrative against the growing demands for reparative justice. So, where does this leave Labour? Will Starmer and Reeves recognise the potential fallout of their pension policies before it's too late? Or will they face the wrath of doctors, voters and international allies alike? This story is far from over. Make sure to like, subscribe and stay tuned as we uncover the twists and turns in Labour's unfolding political drama.